For anyone watching a loved one battle severe, uncontrollable seizures, or watching an infant go through the terrifying jerks of infantile spasms, you know you would do absolutely anything to make it stop. But what if the exact medication prescribed to save their brain functions also carries a strict official warning that it could permanently take away their eyesight? This is the heavy reality of Vigadrone 500mg for oral solution. It is one of the most powerful, highly controlled anti-epileptic drugs on the planet. In the next few minutes, we are breaking down the critical science of how it stops seizures, the exact way to prepare it, and the life-altering visual side effects that every single parent and patient must monitor to prevent permanent damage. Do not skip a single second of this video. What you learn here is absolutely vital. Welcome back to the channel. Today, we are conducting a full clinical breakdown of Vigadrone 500mg for oral solution, which utilizes the active ingredient Vigabatrin. Before we dive into the neurology of this drug, a vital medical disclaimer. Vigadrone is a highly restricted, prescription-only medication. This video is strictly for international educational purposes and does not replace professional medical or neurological advice. To understand why Vigadrone is prescribed when other medications fail, we have to look inside the brain. Seizures are caused by a sudden, chaotic storm of abnormal electrical activity. Naturally, our brains rely on a specialized neurotransmitter called GABA to act as a braking system to calm these electrical storms down. In a normal brain, an enzyme continuously breaks down GABA, but Vigadrone is what neurologists call an irreversible GABA transaminase inhibitor. Simply put, it completely blocks that enzyme from destroying your brain's natural calming chemical. As a result, GABA levels surge, effectively turning down the volume on the brain's chaotic electrical signals and stopping refractory complex partial seizures and infantile spasms right in their tracks. Now we must address the most critical part of this guide, the reason Vigadrone is under a strict safety program in the United States. Vigadrone causes progressive, permanent bilateral vision loss. This means it can irreversibly damage the peripheral vision, the outer edges of sight, in both adults and babies. Because infants can't tell you if their vision is fading, the danger is incredibly high. The vision protocol. Anyone taking this medication must undergo specialized vision testing before starting, every 3 months during treatment and up to 6 months after stopping the drug. The golden rule. Doctors will only keep a patient on this drug if the benefit of stopping dangerous brain-damaging seizures completely outweighs the risk of vision loss. Vigadrone does not come as a standard pill. It comes in 500mg single-dose packets containing a white to off-white granular powder. Preparation: the powder must be completely dissolved in about 10 milliliters of cold or room temperature water before administration. It should be taken immediately after mixing. Other side effects. Beyond the vision risk, patients might experience severe drowsiness, dizziness, hyperactivity in children, or weight gain. The golden rule: never under any circumstances suddenly stop giving Vigadrone. Abruptly halting an anti-epileptic drug can trigger status epilepticus, a continuous, life-threatening state of non-stop seizures. Any dosage changes must be tapered down slowly under a neurologist's direct supervision. Vigadrone 500mg is a clinical masterpiece for seizure control, but it requires absolute vigilance, strict eye exams, and precise tracking. If this international medical guide brought you clarity today, make sure to hit the like button right now. Subscribe to the channel to never miss an evidence-based pharmaceutical review, and drop your questions or experiences in the comments section below. Stay informed, protect your health, and I will see you in the next clinical review.